Senator Josh Hawley opened his remarks by thanking the committee and the witnesses before turning to what he called unbelievable numbers on America's healthcare crisis. He pointed to a chart behind him showing that since 1960, healthcare spending in the United States has skyrocketed by 2,190%. Today, he said, Americans spend more on healthcare than on groceries or housing, and 41% of adults carry medical debt. A recent Gallup report found that 31 million Americans had to borrow money last year just to pay medical bills. Hawley then shared a letter from a Missouri mother.
Thank you very much, Mr. Chairman. Thanks for calling this hearing. Thanks to all of the witnesses for being here. I just want to start with numbers that I think are absolutely unbelievable. The cost of health insurance, the increase in health insurance expenditures or health expenditures since 1960 is up. I think we've got a chart maybe over my shoulder here. Since 1960, there has been a 2,109% increase in the cost of health in the United States, healthcare spending. 2,109% increase. Today, Americans spend more on healthcare than on groceries or housing. I mean, this is extraordinary. More than on groceries or housing. 41% of adults in the United States have debt from medical expenses, and I noticed a recent Gallup report found that 31 million Americans borrowed money last year to pay for health care. 31 million Americans. I want to just add to some of the testimony that's been offered here today by reading you something from a constituent of my state. This is a mother in my state of Missouri. She wrote to me recently and said the health insurance coverage for myself and my two daughters are showing to be $1,500 a month, enough to actually make a mortgage payment. I'm a small business owner and wondering how I'm going to be able to afford this. She goes on to say in that same letter, I thought about just getting insurance for my daughters, but I also remembered the time where I couldn't afford insurance one year, and the doctor and hospital bills were twice as much for cash payers because they bill you the maximum amount possible. I mean, I think we should just be honest about what we're facing here. This is a crisis. This is a crisis. And I realize that in Washington, it's treated sometimes as a numbers game. It's treated as a white paper to be discussed. But for people at home, they cannot afford to go and see a doctor. I'm the father of 3 small children. I can't imagine what it would be like to say, I can't afford it. I can't take my kid to the hospital. I mean, we're fairly frequent visitors to the hospital in my family. I've got 2 boys. We're there a fair amount for their various injuries. And thinking about parents in my state or anywhere else saying, you know what, I think my kid's got a broken bone, but I can't go to the hospital. I can't afford it. I can't go to the doctor. I can't afford it. And millions of Americans are saying that. On the subsidies, on the premium tax subsidies, let's just be honest. If we don't do something on this issue, if Congress does not take action on this issue in the next few weeks, this will be a crisis for 24 million Americans and counting. In my state, premiums are already going up by between 24 and 50%, depending on the healthcare plan, depending on the region of the state. I mean, so we are looking at a massive crisis unless Congress acts and acts soon. And my message is to the leadership of this body, to the leaders of the House, the leaders of the Senate, maybe it's time you all locked yourselves in a room and got to a solution here, because it's not going to be a solution in a couple of weeks to say, well, we just couldn't get it done. We couldn't think of anything. Better luck next year. If that's the attitude that ends up being taken in this body, millions of Americans are going to go without health care coverage. And let's be honest, millions of Americans can't afford it now before we hit the cliff. So I think it's time to get serious here about the crisis that we are facing. We have got to take action on the subsidies. As I've said for months now, listen, I'm open to proposals. I'm open to any proposal that will keep the costs down, but we've got to take action. Doing nothing is not a solution. But I have another suggestion to make, and it's a proposal I'd like to introduce. I am introducing today. In addition to taking action on subsidies, why shouldn't we make healthcare tax-free in this country? Why shouldn't we just exempt all healthcare from taxes? We did no taxes on tips, no taxes on overtime earlier this year. How about no taxes on healthcare? If you pay premiums, you ought to be able to deduct that from your taxes. If you have out-of-pocket medical expenses, you ought to be able to deduct every dollar off of your taxes. You want to lower the cost of healthcare immediately? Do that. No taxes on healthcare for any American. And you set an upper limit so you don't have rich people gaming the system. I get it, that's fine. But let's think about working people in this country who cannot afford health care. What if we said to them today, we're not going to tax your health care costs? Does anybody on the panel have a reaction to that? Let me start with you, Dr. Fagan. We'll just go down the panel. What do you think? No taxes on healthcare.
I've never heard it could work. People are paying a lot for their health care. I think working people look for any advantage that they could get, but I'd have to look at it more in detail.
Ms. Strauss?
Simple answer is yes. Anytime you can get a savings on a tax deduction, absolutely, and especially something around healthcare.
Mr. White, any reaction?
Taxes increase costs, so eliminating them should lower costs. The people here especially affected are the self-employed, and they have to itemize up to 7.5% of their income in order to get the same tax benefit that a big company can get. So what you're talking about is equalizing, leveling the playing field for everyone.
Yeah,
so
that's exactly right.
That makes sense.
That's exactly right. Instead of 7.5%, and you have to itemize, let's move it above the line. Let's say that you can take that deduction, no matter if you're itemizing or not. Very few people itemize, and let's allow them to take the deduction on the first dollar. I mean, that would lower healthcare costs for millions and millions of Americans. I think it's something that we should seriously consider. I am out of time, I guess.
You are. You are out of time.
I am out of time.
Senator Hook in the
Small business owner struggling to afford insurance for herself and her 2 daughters. Her premiums reached $1,500 a month, basically a mortgage payment, she wrote. She recalled a time when she went uninsured, only to face hospital bills that were twice as high because cash-paying patients are charged the full rate. "This is a crisis," Hawley said. "People at home simply cannot afford to see a doctor." As a father of 3, he talked about how often families, especially those with young children, need emergency care. He stressed how devastating it would be for parents to have to delay medical treatment because of cost. And according to data from his state, premiums are expected to rise another 24% to 50% depending on the region and plan. If Congress doesn't act in the next few weeks, he warned, 24 million Americans or more will face a health care cliff. Hawley urged congressional leaders in both chambers to find a solution quickly, saying that failing to act and offering excuses like maybe next year would leave millions without coverage. He then unveiled a new proposal, making all health care expenses tax-free. Earlier this year, Congress eliminated taxes on tips and overtime pay. Hawley argued that health care should be next. His plan would allow Americans to deduct all health-related costs, premiums, out-of-pocket expenses, everything from their taxes. To prevent abuse, he suggested setting an upper limit for wealthy households, but emphasized that the goal is to help working families. "You want to lower health care costs immediately," he said. "Stop taxing health care." He then asked the witness panel for reactions. Dr. Fagan said the idea could help working Americans, though he'd want to review the details. Another expert agreed, saying that any tax savings, especially on health care, would benefit families. Mr. White noted that taxes drive up costs and that eliminating them would particularly help the self-employed, who currently must itemize and exceed 7.5% of their income to deduct medical expenses. Hawley added that very few Americans itemize at all, making his proposal a way to level the playing field. Hawley concluded by saying the idea deserves serious consideration because it could immediately reduce healthcare costs for millions and millions of Americans.